Are you over 70 and still doing every health check your doctor suggests? Some tests might actually do more harm than good. Let's talk about the top 5 health checkups to avoid after 70. Not all medical tests are helpful, especially after 70. In fact, some routine checkups could quietly steal your energy, peace, and independence. These are the 5 health checkups to avoid after 70. Doctors are now warning seniors. Certain tests may seem helpful, but after 70, they can backfire. Here are 5 health checkups to avoid after 70 and what you should do instead. Dear friend, if you're watching this video, chances are you're already in your 70s or have a loved one who is. At this stage of life, we start thinking about health differently. It's no longer about reaching ambitious goals, but about making simple, meaningful choices. How do I feel today? What do I still want to do? Am I truly living each day to the fullest? We're often told that medical testing is always good. The more, the better. But that's not always true, especially after a certain age. Not every test brings value. In fact, some routine screenings can unintentionally do harm physically, mentally, and financially. Many healthcare professionals in the U.S., especially geriatric doctors, are speaking out. They warn that after age 70, undergoing screening just for the sake of it can lead to overdiagnosis, overtreatment, and unwanted consequences. 1. Colonoscopy. Let's talk about something that almost everyone over 50 has heard of: the colonoscopy. It's often described as one of the most important screenings you can get. And for good reason. For people in their 50s or 60s, especially those with risk factors like family history or digestive issues, this test has absolutely saved lives. I've seen it myself: early polyps found and removed before they ever had a chance to become cancer. That kind of intervention is powerful. But I want you to pause with me here and ask a simple question. Just because something is helpful at 50, does it still hold the same value at 75? Because after age 70, especially if you feel well, have no symptoms, and no family history of colon cancer, the answer may begin to shift. I remember sitting across from an 82-year-old gentleman. I'll call him Robert. He was one of those active types, sharp as a tack, walked 2 miles every morning, kept a little herb garden in his backyard. A proud veteran. His energy would put some 60-year-olds to shame. He told me, "Doc, my last colonoscopy was clean 10 years ago, but my new doctor is insisting I do another one, just to be sure." So, he did it. He followed the instructions, drank the prep solution, and tried to stay hydrated. But that night, he became dehydrated anyway, something that's not uncommon in older adults using strong laxatives. After the procedure, still groggy from the anesthesia, he lost his balance at home and fell, broke his hip. The test didn't find anything. His colon was perfectly fine, but his mobility, his independence, that took months to recover, and even then, it was never quite the same. Have you ever felt that way, like you were doing the right thing, only to wonder afterward if it was really necessary? This is why we need to talk about risks in a new way, not in numbers, but in stories, in real lives. Even when a colonoscopy finds something, say, a small polyp, it's important to remember that not all polyps are dangerous. Many grow so slowly that it could take 10, even 15 years before they become cancerous. If you're 75 or 80, that timeline might not even be meaningful anymore. And yet, once a polyp is found, the wheels start turning. Repeat colonoscopies, biopsies, even surgeries. A patient of mine once told me, "I felt like I was pulled into a medical machine that wouldn't stop, and no one asked if I wanted to get on in the first place." That's not how it should be. We should be able to say, let's think this through. That's why respected organizations like the American Geriatric Society are now recommending a more mindful approach. If you're over 70, symptom-free, and had a clean result before repeating the colonoscopy, may not be necessary. And there are gentler, safer alternatives, like stool-based tests done at home. No fasting, no anesthesia, just peace of mind without the risk. So I want to leave you with this question. Are we testing because we see a benefit, or because we're afraid not to? Because after 70, good health isn't about chasing down every possible illness. It's about knowing what truly supports your life, your energy, your clarity, your freedom to wake up and enjoy your day. That's not something a scope can always measure, but you can. 2 full body scan. Let me tell you about one of the tests that's becoming more and more common these days, but also one that increasingly concerns me. It's called the full body scan. It sounds high-tech, and it is. A CT or MRI machine can scan your entire body in just a few minutes. The images are sharp, detailed, and impressive. Some clinics even promote it as a total health checkup, and many people, especially after 60, think, why not? The earlier I know, the better. I understand. Who doesn't want peace of mind? But here's the issue. Not everything you find is worth worrying about. These scans often pick up small things: a shadow on your liver, a tiny nodule in the lung, a faint spot on the adrenal gland that, in most cases, don't affect your health at all. Doctors call them incidental findings. But once we know about them, it's hard to ignore. The mind starts to spiral. You want to be sure. The doctor wants to be thorough. So the process begins: more scans, more specialists, more biopsies, more worry. And sometimes it ends in a surgery no one planned for. I remember a woman, 78 years old, we'll call her Margaret. She was active, loved her garden, drove herself everywhere, fully independent. One afternoon, while walking through a mall, she saw a poster that said, "Whole body scan, just $299, total health protection." She thought, why not? Just to be safe. The scan found a tiny spot on her kidney. She had no symptoms. She felt perfectly fine. But out of fear, she agreed to have it surgically removed. The biopsy came back benign, completely harmless. But after the operation, Margaret was never quite the same. She grew weaker, lost weight, had trouble sleeping. And the part that saddened me most? She lost the sense of peace she had before the scan. Have you ever found yourself in a story like that? Sometimes the real cost isn't in dollars, it's in energy, it's in time. It's in the months spent living in fear of something that may never have hurt you in the first place. Let me be clear, I'm not against medical technology. I don't deny the value of early detection when it's truly needed. But I do believe that after 70, every decision about testing should come from understanding, not from fear. Healthcare at this age should not be a checklist of automatic scans. It should be a thoughtful, personal conversation just like this one. How am I really feeling? Will this test actually change how I'll be treated? Am I ready for the consequences of finding something that may not matter? Because in the end, not every new discovery leads to a better life. Sometimes, what you really need is just a quiet afternoon, a warm cup of tea, and the quiet confidence that you're still in control of your life, and that feeling no scanner in the world can measure it. 3. Cardiac stress test. Let's talk about the heart. Not just the physical heart, but what it represents. It's the center of life. It's where we hold our joy, our excitement, our fear. It's where we feel love deeply, and where we often feel the first whispers of anxiety when something seems off. That's why, for many people over 70, Even without a single symptom, the idea of doing a cardiac stress test sounds like the smart thing to do. Just to be sure, just to know everything's okay. On paper, the test seems harmless. You walk on a treadmill while your heart rate, blood pressure, and EKG are monitored. But once you reach a certain age, things aren't as straightforward as they used to be. Blood vessels become stiffer. Blood pressure is less predictable. The electrical patterns in your heart, what we see on the EKG, can shift slightly, and those changes aren't always signs of disease. But a machine doesn't know that. It just highlights what looks abnormal. And then, doctors, well-intentioned and cautious, feel obligated to act. And before you know it, you're scheduled for more tests. An angiogram, a catheter inserted through your wrist or groin to look at the arteries around your heart. Maybe even a stent placed. Sometimes all of this happens based on a single result that wasn't even dangerous to begin with. It's what we call a false positive, something that appears to be a problem, but isn't. But what follows? That's real. The bleeding, the potential for infection, the impact of contrast dye on your kidneys, the recovery process that can last for weeks, even months, especially in older adults whose bodies take longer to bounce back. I remember a man named George. He was 76, in great shape, no chest pain, no breathlessness, just wanted a checkup, just in case. He went through the whole chain stress test, angiogram, stent. Afterward, he looked at me and said, "Doc, I walked into that clinic feeling great. I haven't felt right since I left the hospital." That stuck with me, and it still does. So I want to gently ask you, are you doing the test because something doesn't feel right? Or because something inside you is afraid of what might go wrong? Because if you're having chest pain, if you're feeling short of breath, then yes, get checked. Don't ignore those signs. But if your body feels fine, if you're active and clear-headed, and the only reason you're being tested is fear, then maybe it's time to pause. Sometimes it's not illness that makes us sick. It's the constant search for it. Health, especially after 70, isn't just about ruling out every possibility. It's about tuning in to what really matters, how you feel, what you're capable of doing, whether your life feels balanced and steady. You don't need a treadmill test to tell you that. Sometimes what your heart really needs most is to be trusted. 4. PSA test. This brings us to a test that has sparked more questions than answers over the past few decades, the PSA test for prostate cancer. It's a simple blood draw, quick, routine. It barely takes a minute. And because of that simplicity, it's often offered without much discussion. But what happens afterward is where the real story begins. A high PSA level, even a slightly elevated one, can trigger a chain reaction. Suddenly, you're being told you need a biopsy, a needle inserted into your prostate. It's uncomfortable. It carries risks of bleeding, infection, and emotional distress. And it's not just the procedure itself. It's the waiting, the uncertainty, the fear that takes hold while you wait for results that might not even matter. And here's the part that's often overlooked. In most older men, elevated PSA doesn't mean cancer. It means benign growths, completely non-threatening. Or, if cancer is found, it's usually the slow-growing kind, the kind that wouldn't have impacted your health or shortened your life. Still, I've seen so many men go through the full arsenal of treatment: radiation, surgery, hormone therapy. Not because the cancer was aggressive, but because they were scared. And who wouldn't be? The word cancer carries so much weight. It makes people feel like they have to act right now. But after all that, Many are left dealing with things they never expected: urinary incontinence, sexual side effects, a constant cloud of anxiety, and a question they quietly carry with them. Did I really need to go through all of this? One man told me, "I beat cancer, but I lost a part of myself in the process." That stayed with me. That's why today, the leading experts in both urology and geriatrics across the US agree PSA testing shouldn't be routine for men over 70, not unless there are clear symptoms or a family history that calls for it. It's not about denying care, it's about tailoring care, about recognizing that what helps at 55 doesn't always help at 75. So when is it time to stop? That question can feel heavy, but it's not about giving up. It's about choosing differently. When we were younger, we believed that more was always better. More tests, more answers, more interventions. But somewhere along the road, especially after 70, a new wisdom starts to emerge, and it whispers something quieter, but more powerful. Less can be more. We don't live to chase down every possible risk. We live to walk without pain, to speak with clarity, to cook a meal for someone we love, to sit on the porch, feel the breeze, and hum along to a song we forgot we remembered. And to have those things, we don't need to scan every inch of our body or measure every number. What we need is to know ourselves, to understand what truly affects our quality of life and what doesn't need to be chased or fixed. I once heard an older physician say, "I'm not afraid of illness. I'm afraid of losing my right to decide." And that struck me as one of the deepest truths about aging. Because after 70, one of the most valuable things you have left is choice. The freedom to say no. The courage to ask, "Will this actually help me live better?" And the clarity to walk away when the answer is no. If there's anything we should be protecting at this point in our lives, it's not just our health, it's our peace. Peace in the body, peace in the mind, peace in every decision we make with care and understanding. Over the years, I've noticed something quietly beautiful. The older we get, the less we chase knowledge for the sake of control. Not because we've become fragile, but because we've become wise. We start to understand that more information doesn't always lead to better living. In fact, sometimes it makes life heavier, more uncertain, more stressful. We live in a world obsessed with more scans, more numbers, more data. But after a certain point, we start to crave something different. A slow afternoon, a simple meal, a conversation that doesn't feel rushed, a moment of stillness where nothing has to be fixed. And sometimes, to get back to those small, meaningful joys, we have to say no. No to tests that bring more confusion than clarity. No to fears that don't belong to us. No to a system that forgets we're not just bodies, we're people. People with values, with experiences, with the right to decide. You still have a voice. Don't let it be drowned out. 5 repeated or routine screenings without symptoms. Now picture this. You're in a doctor's office. The doctor suggests a test. You feel fine. You have no symptoms. But out of fear, you agree. A week later, the results come back. Something small shows up. Then you're sent to a specialist, then an MRI, then a biopsy, then surgery. After all of that, you're exhausted and you don't feel any better. This happens every day. And the saddest part is, many people don't realize they could have stopped at the first step. You could have asked, "Will this test change my treatment? What happens if I don't do it? Is there a safer, simpler option?" These aren't difficult questions. They're your right. A geriatric doctor once told me, "The best care isn't doing everything, it's doing the right thing." Sometimes that means doing nothing, because after 70, living well isn't about finding more illness. It's about keeping life as light and joyful as possible. If you've ever felt anxious for declining a test, you're not alone. Many people your age have felt the same, but they've also learned to trust their bodies, to trust what they've lived through, and to know that no one understands them better than they do. Think of the last time you laughed, or had tea in the sun. Those moments are real. They are life. No medical scan can give you that. So what truly matters in the end? That you live in a way you choose. That you receive care with respect, not just for your age, but for your values. That your voice is heard. If this video made you rethink something you once believed you had to do, then we've done our job. Not to make you afraid, but to help you pause, ask, and choose with confidence. Have you ever had a test that made you wonder afterward, maybe I shouldn't have done that? Or found yourself lost in a series of procedures and no longer sure why? We want to hear your story, because your words might help someone else, someone still wondering, should I do just one more test? Thank you for watching until the very end. That alone tells me something important. You're not just taking care of your health, you're taking charge of it. Because after 70, health isn't just about medicine. It's about choice. It's about freedom. And most of all, it's about dignity. It's about waking up and knowing you're still the one deciding how you want to live. It's about making decisions that reflect who you are, what you value, and what truly matters to you. And more than anything, we hope you live the rest of your life with peace in every decision, clarity in every step, and joy in every single day, no matter how ordinary it may seem. If this message resonated with you, please don't keep it to yourself. Click like so more people see it. Share it with someone you care about, your spouse, your sibling, your best friend, because you never know who might be quietly carrying the same questions. And if you haven't already, hit the subscribe button and join our growing community. Every click, every share, every subscription helps us bring these heartfelt, practical messages to the people who need them, most people just like you. People who deserve to age not in fear, but with knowledge, calm, and confidence. We're here for you, and we're grateful you're here with us.